Today, we're going to talk about an incredibly pressing and controversial topic: the effects of tobacco company financing on behavioral change and reducing the incidence of lung cancer. Now, let's be clear from the start. Tobacco companies have long been under fire for their marketing tactics and the adverse health effects of smoking. We know that smoking is one of the leading causes of lung cancer, and it's a habit that's notoriously difficult to break. But here's the question: can tobacco companies play a role in decreasing smoking rates and ultimately reducing the number of cases of lung cancer? It's a complex issue, so let's dive right into it. On one hand, there is an argument that tobacco companies have the resources and expertise to make a significant impact on tobacco cessation programs. They have the financial backing and distribution networks to reach a wide audience, especially through their vast advertising and promotional campaigns. By funneling their profits into educational campaigns and support services, they may be able to effectively promote healthier lifestyles and help people quit smoking. We have seen examples of tobacco companies taking small steps in this direction. For instance, they've supported initiatives that raise awareness about the dangers of smoking, provided funding for research on smoking cessation methods, and even created their own programs to assist smokers who want to quit. These efforts, however limited in scope, do show some potential for positive change. But here's the counter-argument: can we trust tobacco companies to prioritize public health over their own profits? After all, they are profit-driven corporations with a long history of manipulating public opinion and downplaying the risks associated with smoking. It's hard to reconcile their financial interest with a genuine commitment to reducing lung cancer rates. Furthermore, there is the concern that tobacco companies may use their influence to shape public health policies in ways that benefit their bottom line. History has taught us to be wary of the influence of big corporations on government regulations, and the tobacco industry is no exception. If these companies were to finance public health initiatives, how can we ensure that they won't have a say in shaping the direction of these programs and policies? There's also the ethical dilemma of accepting funding from an industry that has caused so much harm. Taking money from tobacco companies could be seen as compromising the integrity of the organizations or individuals involved. It raises questions of conflicts of interest and the potential for the prioritization of profit over public health. So, where does that leave us? Can tobacco company financing truly have a positive impact on behavioral change and reducing lung cancer? The answer isn't clear-cut, as there are valid arguments on both sides. On the one hand, their financial resources and reach could be harnessed to make a significant impact. On the other hand, trusting these companies to act in the best interest of public health raises significant concerns. Perhaps the solution lies in strict regulations and oversight. If tobacco companies were required to meet certain criteria, such as independent monitoring and evaluation of their efforts, we could potentially mitigate the risk of their influence and ensure that their actions genuinely serve the greater good. Ultimately, the goal should be to reduce the prevalence of smoking and lung cancer, and if tobacco companies are willing to contribute to that effort, it's worth considering. However, we must approach this with caution, keeping in mind the potential risks and ethical considerations involved. In conclusion, the question of tobacco company financing and its effect on behavioral change and reducing lung cancer is one that demands careful examination. While there is potential for positive impact, we must be hesitant to fully trust an industry that has profited from a deadly habit. Striking a balance between accepting their support and safeguarding public health is the key challenge we face moving forward.